If you have to do the wave, do the wave. BSI, scene safety. And then, first dispatch is telling us what?
You've gotten dispatched to a gal who fell off her roof, taking down the Christmas lights.
Okay, so we know it's a fall, and we know we have one female patient. So number of patients, we have one. It is a mechanism of injury because she did fall. And then at this point, I think me and my partner can handle it, so I don't think I'll need more additional resources at this time. So when we're approaching the scene, I'm gonna have my partner take C-spine, and then I'm gonna determine her level of consciousness. Hey ma'am, I'm Frank with Western Ambulance. What seems to be going on today? She fell. Do you know where you're at?
She doesn't.
She does not know where she's at. What's your name? She's confused. And then, do you know what day it is?
No.
So she's not alert and oriented. So she has an altered mental status. So at this time, I'm going to automatically make her a high priority patient. What seems to be hurting? Your leg hurts? Your left leg, right leg?
Right.
Her right leg hurts? Is that the only thing that hurts you? You don't know. So, yeah, it's a little confusing, but we do know she does have a leg injury that's hurting her, so that, as far as we know, that is going to be her chief complaint other than her altered mental status. So now we go into our ABCs. Her airway, right now she's talking to us, so she has a patent airway. If she wasn't and she wasn't breathing, we would then open her airway. How would we open her airway? She fell. We're taking C-spine. Jaw thrust. So Chris would do that for me. And then there's some extra things here for airway. Adjunct. If we need an adjunct for this patient, we would then insert one. But she seems to be talking to me, so at this time I will not put an adjunct in. So we're going to assess her breathing. There's a couple ways we can do that. I always like to do the look, listen, feel. We have stethoscopes, we can listen. We can have her take a deep breath in, and then we can see that chest rise. And then we can also ask our patients, are you having any difficulty breathing?
Yes.
Yes, great. So I'm gonna, great. Don't say that to your patient. So I'm gonna apply a non-rebreather mask at 15 liters of oxygen for you, for her oxygen therapy. And then rank quality we'll check for as well. There's something, adequate ventilations with our oxygen, and then if there's any injuries compromising the airway, so anything in the neck, if she's choking on anything, we have to manage that and we have to fix that. This time there is not. So again, we did say she was high priority. Now we're going to check circulation. So we're going to check pulse.
Present.
Present. We're going to check her skin, which is pale, cool, and clammy at this moment. And then we're going to look for any major bleeds. And we have no major bleeds. So she's pale, cool, and clammy, which indicates what? Shock. Shock. So we're going to now treat for shock, and we're going to lay her flat. Right? And then we're going to cover her up as well. And she does have the oxygen. So again, she's a high priority patient. So then we're going to get our baseline vitals. We're going to get our blood pressure, our pulse, and our respirations. And then at that time, we're going to try to get sample, but she's altered. So who can we get sample history from?
Bystander.
Bystanders, if there is anybody.
I'm a bystander. What would you like to know?
What is she allergic to anything?
I don't think so.
You don't think so? Did you know if she takes any medication?
She does. I think she takes an inhaler.
An inhaler. Ooh. Okay. Do you know if she took that today?
No. She doesn't usually take it.
Great. Any past medical history that we need to know about?
Just asthma when she exercises.
Okay. Do you know if the last time she had anything to eat or drink?
We had lunch at like noon.
Okay. And then, do you know the events leading up to this? Why she's here?
She just was sick of Christmas still being in the house, so she just, boyfriend isn't doing it. He won't climb up there, so she got up there and she just lost her balance, was reaching too far, and off she went.
All right. And then we have our signs and symptoms. And then after that, we're going to do our head-to-toe assessment. So we're going to literally palpate her entire body. And we want to explain that to them, what we are doing. We just don't want to just start in on them, right? With adult patients, we start at the head. With pediatrics, we start where?
Toes.
Feet. Oh. I don't know your name. Ma'am, I'm gonna palpate your entire head, your entire body. Tell me if anything hurts, all right?
Her name's Clara.
Clara, hey, Clara. So literally we want to palpate. We don't want any of this. This is not acceptable. We want you to actually touch. Go through the eyes, down the nose, cheekbones. Can you open your mouth, Clara? And look for any broken teeth, any fluids in there. Then we're gonna come down, reach behind the neck, make sure everything feels right there. Things aren't out of line. Ears, yep. Gonna look for any blood, any bruising behind the ears, any CSF coming out of the ears. Again, with the eyes, we're gonna look for that bruising as well, raccoon eyes. In the neck, we're gonna look for, make sure the trachea is midline, and we're gonna look for any JVD, jugular vein distension. From there, we come down to the clavicle. Pressing. Tell me if anything hurts. Chest again, we're gonna listen. Here, 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 and here. Okay, can you take a deep breath? Good. Feel those ribs, abdomen. Anything hurt in the abdomen?
Yes.
Yes. Do you know where? Lower. So if someone does tell us we have any pain in our abdomen, especially if they tell us where it's at, we want to not press on that first, for sure. We want to avoid that and then come back and do a light palpation there. So if she tells us this hurts, we're going to probably start down over here. Kind of come up here. It's under there. Yep. We still want to palpate, but we don't want to really hunker down on that because we still want to feel if there's any rigidity or anything going on there. Pelvis. Any pain in your pelvis? No? So we can kind of press down and then open up. And come down to the legs. And we don't want to do this, right? We really want to get that entire leg. She said one hurt, so she really didn't tell us what. So we really have to find out.
Right leg.
Feel if that, she did say right?
Yeah.
Sorry, okay. Good. So great. All the way down. Okay, boots will be off. We're gonna check for what?
Pulse.
Pulse. Here, here. Can you wiggle your toes? What toe am I squeezing?
My big toe.
Big toe. Which covers our CMS. Come to the other leg. Oh, right here is hurting. Great. That's great. Don't tell them that. Okay. Make sure the knee's still there. Everything's good there. Come on down. Checking for a pulse.
Present.
Can you wiggle your toes? A little bit. Can you feel what toe that is?
Big toe.
Big toe.
And he'd expose to look at the injury at the
Yeah.
time.
So here, we've cut that open and note it. Is it a life threat at this point? No. So we're not gonna stop what we're doing to fix that. We can manage that after we have done the entire palpation of the body. Genitalia we'll look at too as well, if there's any major bleeding, and for males if there's any priapism. Everything seems to be good there, so we'll go to the arm. Check for a pulse.
Present.
Can you wiggle your fingers? Can you squeeze my hand? Both finger lengths. Squeeze them. Oh, here. Never step over your patients. Try to go around them. Pulse.
Present.
Can you wiggle your fingers? Can you squeeze? What finger do I have? Thumb. Great. So now we have to do her posterior. How are we gonna check her posterior?
Roll her on the side.
What side are we gonna roll her?
The
Left.
one without her bed.
Yes. So I'll need a EMT assistant. Sorry. And on our heads count, we're gonna roll our patient. Be gentle around the.
On the count of 3 up to 90 degrees. 1, 2, 3.
Okay. So we want to check right at the top, all the way through the back there, down through the buttocks, and then kind of down that leg. And we should have got the entire leg when we went through that as well. If you guys come back over here and kind of look too, Want to make sure we have control as well, because if something happens and I let go and I'm reaching down here and she's going this way, it's bad, right? So we want to make sure she is protected. So when you're at this point, you can kind of switch your hands. You want to make sure you have control. And on the head count, we'll go back,
On the count of 3. 1, 2, 3.
and then at that point, it would be on a longboard.
And he talks with his hands, so he did take his hand off. But it's because he talks with his hands when he's teaching. So don't take your hand off her.
Take your hands off. When we do longboard, what do we always apply to our patients?
Cervical columns.
All right, so we checked our posterior. Now we can, and she's on the longboard, now we can actually fix what was wrong. So we would splint our leg. Full body splint works as a backboard, works as a full body splint. We could put a towel there, use a cravat to hold everything together. And then at that time, we'll do our reassessment. And we're gonna just reassess every how many minutes?
15.
She's a high priority, 5 minutes.
Oh, yeah.
Every 5 minutes, because she is a high priority patient. And then if there's anything else we need to manage or fix, we would do at that time.